Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about shingles, and not the ones that are on your roof. Shingles is an infection caused by the varicella zoster virus, which is the same virus that causes chickenpox. Even after the chickenpox infection is over, the virus may live in your nervous system for years before reactivating as shingles. Shingles may also be referred to as herpes zoster. This type of viral infection is characterized by a red rash that can cause pain and bruising. Shingles usually appears as a stripe of blisters on one side of the body, typically on the torso, neck, or face. Most cases of the shingles clear up within 2 to 3 weeks. Shingles rarely occurs more than once in the same person, and according to the CDC, approximately 1 in 3 people in the United States will have shingles at some point in their life. The shingles rash has clear characteristics that include red patches, fluid-filled blisters that break easily, a rash that wraps around from the spine to the torso, and a rash on the face and ears, and it includes itching. Some people experience symptoms beyond pain and rash with shingles. These symptoms may include a fever, chills, a headache, fatigue, and muscle weakness. Rare and serious complications of shingles include pain or rash that involves the eye, which should be treated immediately in order to avoid permanent eye damage, loss of hearing or intense pain in one ear, dizziness or loss of taste in your tongue, bacterial infections, which you may have if your skin becomes red, swollen, and warm to touch. Who exactly is at risk for shingles? Shingles can occur in anyone who has had the chickenpox. However, certain factors put people at risk for developing shingles. Risk factors include being 60 years of age or older, having diseases that weaken the immune system, such as HIV, AIDS, or cancer, having had chemotherapy or radiation treatment, or taking drugs that weaken the immune system, such as steroids or medications given after organ transplantation. Shingles in older adults is quite prevalent and is most common in those who are between 60 and 80 years of age because of older immune systems. Seniors with shingles are more likely to experience complications than the general population, which include more extensive rashes and bacterial infections from open blisters. They are also more likely susceptible to both pneumonia and brain inflammation, so being seen by your healthcare provider early on for antiviral treatment is crucial. To prevent shingles, adults who are 60 years old and older should receive the shingles vaccine. To relieve pain, you can apply cool washcloths to the blisters. Keep the rash covered as much as possible to avoid spreading the varicella virus to others. Ask your provider if you're a candidate for antiviral medications, which can reduce the length of intensity of the virus. Your provider can also prescribe pain medications if necessary. Getting shingles during pregnancy is unusual, but it is possible. If you come into contact with someone who has had the chickenpox or an active shingles infection, you can develop chickenpox if you have not been vaccinated or if you have never had it before. Depending on the trimester you're in, having chickenpox during pregnancy can result in birth defects. Getting a chickenpox vaccine before pregnancy can be an important step in protecting your child. Shingles is less likely to cause complications, but it still can be unpleasant. See your healthcare provider right away if you develop any rash during pregnancy. Antiviral medications used to treat shingles can be used safely during pregnancy. Antihistamines can also help reduce the itching, and Tylenol can help reduce the pain. Diagnosing shingles in most cases can be done with physical examination of rashes and blisters. Your healthcare provider will also ask questions about your medical history. In rare instances, you may require to provide a skin sample or a sample of the fluid from those blisters. This involves using a sterile swab to collect a sample of tissue or fluid to confirm the presence of the virus. Treatment for shingles is designed to help deal with the virus and the discomfort associated with it. There's no cure for shingles, but medication may be prescribed to ease symptoms and shorten the length of the infection. Medications prescribed are varied and include antiviral, anti-inflammatory drugs, antihistamines, numbing creams and gels, and occasionally narcotics. Home treatment can also help ease your symptoms. Home treatments can include rest, applying cold, wet compresses to the rash to reduce pain and itching, applying calamine lotion to reduce itching, and taking colloidal oatmeal baths to ease pain and itching. Shingles typically clears up within a few weeks and rarely reoccurs. If your symptoms haven't lessened within 10 days, you need to call your healthcare provider for follow-up and reevaluation. potential complications. While shingles can be painful and bothersome on their own, it's important to monitor symptoms for potential complications. These include eye damage, which can occur if the rash or blister is close to the eye, bacterial skin infections, which can easily occur from open blisters and can be severe, Ramsay-Hunt syndrome, which can occur if shingles affects the nerves in your head and can result in partial facial paralysis or hearing loss if left untreated, pneumonia, brain or spinal cord inflammation, such as encephalitis or meningitis, which is serious and life-threatening. Therefore, it is imperative to contact your healthcare provider immediately. Preventing shingles is a reality. Vaccines can keep you from developing severe shingle symptoms or complications from shingles. All children should receive 2 doses of the chickenpox vaccine, also known as varicella immunization. Adults who never had chickenpox should also get this vaccine. The immunization doesn't necessarily mean you won't get the chickenpox, but it does mean it will prevent 9 out of 10 people who get the vaccine and will decrease the severity if you do get the chickenpox. Adults who are 60 years old and older should get a shingles vaccine, also known as the varicella zoster immunization. This vaccine helps to prevent severe symptoms and complications associated with shingles. Shingles is very contagious. If you become infected, certain steps must be taken to prevent the spread of the infection, including keeping your rash covered, avoiding contact with people who have not had the chickenpox or who have a weakened immune system, and frequently wash your hands. If you have any questions or comments on what we discussed today, or if you have a topic you'd like to learn about, please leave them in the comments section below and we will get back to you. Remember to follow us on Facebook or on our website, The Boca Voice. I'm Dr. Amy Schreibman, and I'll see you next time on Medical Minutes.